Hello, everyone. My name is Gil Penalosa, and this is Cities for Everyone, the webinar, where every other week I invite fascinating people to share their stories, their knowledge, their experience, so that all of us can become better advocates on creating cities that are more equitable, sustainable, and fun. Originally, I'm from Bogota, Colombia, but I've been living in Toronto, Canada for the last 26 years. And 20 years ago, I created a nonprofit 880 Cities. And I've been very fortunate to have worked in over 350 cities around the world, delivering keynotes, advising, doing master classes. And this webinar is a way of giving back, always free and hopefully always interesting. Today, we have an amazing guest, Giselle Sebag. She is the executive director of the International Organization on Urban Health. And she's going to be talking about how thriving cities define our health, our happiness, our future. And I'm so excited because I'm totally convinced that we would have much better cities if every decision had to be evaluated on the impact on health, physical, mental, and social. And maybe the best urban planner would be a great chief public health, or the best chief of public health would be a great urban planner. And actually, they should work together. It's almost interwoven. Giselle, thank you very, very much for having accepted the invitation. I'm very much looking forward to this talk. And please tell us, who are you? And tell us about how is it that thriving cities define our health, our happiness, and our future.
Thank you so much. Well, thank you so much, Gil, for inviting me to take part in this important webinar series. You've had so many of the world's greats on city planning and design, so I feel so honored to be here with you all. I'm Giselle Sebag, an architect, urban planner, and public health practitioner dedicated to transforming cities by design. Last year, I founded Vital Cities, an evidence-driven consultancy that partners with private sector and city governments to ensure urban investments deliver the greatest possible impact, enhancing health, quality of life, and economic returns. And our goal is simple: to create thriving cities where people can live longer, healthier, more fulfilling lives. I also serve as the first ever dedicated executive director of the International Society for Urban Health. So for over 2 decades, the International Society for Urban Health has been at the forefront of defining and advancing the field of urban health, recognizing that cities function as complex, interconnected systems distinct from non-urban environments. And as urbanization continues to accelerate worldwide, often, as we know, outpacing proper planning, the impact of that rapid city growth on public health has become a really important and critical challenge around the world. So until recently, though, there really was no dedicated global effort to study how these massive shifts affect our health and well-being. So we do work across all of the traditional disciplines and sectors to ensure that urban design and policy and infrastructure, all of that come together to foster healthier, more equitable communities. And of course, one of our greatest priorities is bridging the gap between research and real world action and impact, and translating the decades that we have now of evidence into actionable strategies that improve neighborhoods and cities for everyone, regardless of their race, their background, their age, their income, or even their geography. So of course, cities for everyone, something that's very close to Gil's heart. So today I'm going to take you on a journey. I will do my very best to keep us under time so that we have good amount of time for questions and input. But I want to take you on this journey to rethink how we see cities today, not just as the physical spaces, but actually as engines of health and well-being. And of course, maybe some of you know this, but what if I told you that where you live, your zip code, your postal code, your neighborhood has more influence on your health than your genetic code, or more impact than the healthcare that you have access to or the doctors that you visit? The design of our neighborhoods, the places where we spend most of our time, it really determines how we move, the air that we breathe, our stress levels, our social connections, and of course, even how long we're going to live. And so that means that cities, when designed well to really support health, can be one of the most powerful tools that we have to improve health. But yet, very often, too often, we fail to recognize this really incredible potential. So let's just
Giselle,
dive.
sorry,
Yep.
are you passing slides?
No, not yet. So
Oh,
can you
sorry. Okay,
see
I
my
was
slide
gonna say
now?
that they were not moving. Sorry for the interruption.
That's okay. Tell me if you don't see when I go to the next right now, okay? Thanks. But let's just dive into what makes cities truly thrive and what makes a place that enhances rather than harms our health and well-being. So that's what we'll be talking about today. Okay, so I've advanced the slide. So let's begin by looking at one of the most dramatic urban transformations in recent history. This is Bryant Park in New York City. I'm sure many of you know it. Many of you have been there. And I want to take a look quickly at its evolution over time, because I think that together these images tell a powerful story about the role that urban design and planning has in shaping public health, safety, and economic prosperity. And something that, and this is blurry, I know because it's so old, but something that is notable that I want to mention, the reason I wanted to show this picture is because at its core, the park, through the many transformations that it had, the park itself stayed pretty much the same, like this image. And it actually took a lot of programming and activation and small urban design tweaks, something that now we call more placemaking activities, to transform it into such a thriving success story that it really is today. Okay, so Bryant Park has always been a significant public space in Midtown Manhattan, but in the early 1900s, it was well maintained but pretty underutilized, and it had these demonstration gardens planted during World War I. And I thought, oops, okay, let's see. Hold on, I'm sorry, I'm going too fast here. Okay, there we go. And then in the 1930s, okay, here we are. These are the demonstration gardens, which are, like the old community gardens or the victory gardens that we see in other places. So I thought that was notable. And then in the 1930s, under Parks Commissioner Robert Moses, the park was reconstructed with formal gardens and a central lawn, and it was intended to be the civic centerpiece. But some of the design decisions, such as raising it above street level, we would realize that that sort of contributed to its decline. And then in the early 70s, in the 70s and early 80s, rather, Bryant Park really had become a symbol of urban decay. So it had these really, as you can see, it had these really high walls and these hedges that you couldn't see past from the outside, really making the park itself feel hidden and unsafe. And that really did contribute to turning it into a haven for crime or drugs and prostitution. New Yorkers at this time called it Needle Park, and it was definitely a place to avoid rather than enjoy. And then the businesses around the park also suffered because of that. Despite its prime location behind the New York City Public Library, it was effectively abandoned by the general public. And so, what is the root problem here? It was disconnected, uninviting nature of the park itself. Those high walls, that higher elevation, those enclosed spaces really isolated people who might have come in from the street, creating really the perfect conditions for crime to flourish. So in the early 70s and 80s, emerging, I'm going to call them urban observers, led by Holly White, Project for Public Spaces, and others, were studying how people actually interacted with public spaces by directly observing public spaces in New York City, and then later taking hundreds of hours of video footage. Maybe some of you have seen it. You can see it in films like The Social Life of Small Urban Spaces. That, by the way, was the first film I was ever shown in my freshman architecture class. I thought that was a good choice. And their research identified these key design flaws that explained in part why many public spaces, even with great locations in New York City, remained underutilized despite the city's high population density. And they started to propose some practical evidence-based solutions. So for Bryant Park, these included lowering the park to street level to increase the visibility and accessibility, removing some of those visual barriers to make the space feel more open and also welcoming. They put in, this is really big, as many of you know, they introduced 1,000 movable chairs instead of fixed benches, which allowed people to actually choose where they were going to sit during different parts of the day as the sun moved around. We know that today that's huge. And then they added a steady stream of activities and events to bring consistent foot traffic at all times of day, attracting all different types of people, young and older people, poor and well-to-do people, bringing them all together. They also brought in food kiosks, retail spaces to keep people engaged. And, actually at the time, these changes were really radical, but they were rooted in this very simple idea. I sometimes think the most brilliant ideas are the simplest, that people use public spaces when they feel safe, when they feel comfortable, when they're inviting, and when they have something to do. Oops, sorry. Okay, there we go. So here we can see a lot of the different things that we have in Bryant Park. And the result, of course, is that Bryant Park went from being an incredibly dangerous, avoided space to one of the most visited, most vibrant, and also economically successful parks in the world. So after this redesign, crime dropped by 92%. Office rents around the park increased by over 200%, making it today still one of the most valuable commercial areas in all of New York City. It hosts over 1,000 free events annually, including things like ice skating, concerts, movie nights. And I think the reason I wanted to tell you this story is because I think it proves that design is not just about aesthetics, but it's also about public health, economic development, and social connection. And when we build cities and places that prioritize people, we create places where communities thrive, where businesses can succeed, and where health improves. So I think it's a reminder that public spaces and the spaces we share in our cities are not inherently safe or dangerous, but really the way we think about them are the design, the programming, the activation determine how they are used. And we can really take these lessons and apply them to cities everywhere around transforming underused spaces into thriving community hubs. So that's what we'll do today. Cities are not fixed landscapes. They are shaped by human decisions. And when we design them to fail us, it means that we can also redesign them to help us thrive. So let's talk about that. So what determines our health outcomes? There are a multitude of ways that our social and physical environments make an impact on our health and well-being. And I usually think about them in three main categories. So that's your genetics. That's what we're born with, things you can't change. Your environment. And when I think about environment, I'm talking about your natural, built, and social environment, and also behavior. So these are the choices that we make about what we eat, if we're going to exercise, whether we smoke or take drugs or drink alcohol. And the good news is that from the research, we have a huge amount of research now, and we know the scientists have figured out that the leading drivers of death and disability around the world, those are mostly in all places around the world today. Those are non-communicable diseases, things like heart disease, cancer, hypertension, diabetes. They are largely determined by a combination of both your environment and your behaviors. But the good news is that your behavior and your environment are changeable. And so when we look at the research around how much of our health outcomes are actually determined directly by our genetics, things we cannot change, it's really no more than 10%. And what does that mean? That means that the other 90% or more are linked to changeable place-based factors. So, sometimes people don't think about behavior as being, or don't think about environment as being changeable. But in fact, they are. And your behavior is also highly influenced by your environment. Because, for example, if your doctor tells you to get more physical activity or to walk outside or to get more exercise, how can you do more walking or biking if you don't have a sidewalk or you don't have a safe cycling lane? Or how could you eat healthier food if the only stores in your neighborhood sell processed junk food or alcohol and the only restaurants serve fast food? So the point is, even if we aren't all trained medical doctors or healthcare providers shaping the environments that we live in, we all actually wield this tremendous amount of influence over building natural spaces, built environments, facilitating social connections and activities in ways that can explicitly support our health, regardless of our quote unquote profession. And we all have this significant power to create neighborhoods and communities and cities which make the healthy choice the easy choice by designing, for example, safe walking and cycling paths, which we're going to talk about. So people have the choice to safely engage in physical activity, or by incorporating nature or green space into our lives, or creating healthy food environments rather than food deserts or food swamps. And of course, the starkest example of how place impacts health is when we look at life expectancy. So in most cities around the world, life expectancy can differ by 20 or even 30 years between neighborhoods that are just a few kilometers or a few miles apart. They're not physically very far apart. because the places that we live and work and spend our time, they affect this really, really, really wide range of health risks and outcomes. And we're going to talk about a few of the key ones today, but there's so many, we wouldn't have time to talk about all of them. And so the determinants of health include things like the neighborhood physical environment, housing conditions, occupation, education, economic stability. We call those social determinants of health. And I always think it's so shocking. But the number one predictor of your life expectancy or how long you're predicted to live when you're born isn't, isn't your income, it isn't your healthcare access, it isn't your doctors, but it's actually where you live or your zip code or your neighborhood. So when babies are born at the same time, just a few kilometers apart in major cities around the world, they might have lifespan differences of nearly 30 years, depending on what neighborhood they live in. And if we look at the United States, for example, I saw many of you here are from the US today. We can look at the 500 largest cities in the United States, for example, and 56 of those have what was considered a very large life expectancy gap between neighborhoods, where on average, people in one neighborhood can expect to live 20 or 30 years longer than their neighbors a few kilometers away. And that is ridiculous, of course, because we know that we know exactly what to do. We know exactly how to solve this. And it's not just that it makes an impact on our life expectancy, although that's really important. It's life years lived. It's also the quality of life lived, but there's a huge economic cost to that. So chronic diseases, for example, related to poor urban planning alone. So just that one piece costs in the United States $3.7 trillion per year in healthcare expenses that are avoidable by design. So that's really just the tip of the iceberg. We could look at so many other economic costs associated with poor planning decisions that do not support health. But again, the good news here is that we actually have the power to change those outcomes. And so hopefully what you're starting to see is that a lot of those decisions that actually make the biggest impact on our health are coming not from the healthcare sector, not from pharmaceutical companies, not from medical professionals, doctors, or surgeons. Those are all people who treat you once you're already sick. And many times we're already sick from our environments. But instead, much of what impacts our health is actually being decided on by non-health actors who are designing the physical and social experiences that shape our lives. And oftentimes, they are not considering the health impacts of those decisions. So again, it makes all of us, anything that we do to change our physical and social conditions in our cities, that maybe you're a policymaker, maybe you're a government official or city planner, an urban designer, or real estate developer, architect, landscape architects, or just an engaged resident in your neighborhood. All of us are critically important public health workers. Okay, so here are some of the many ways. Again, we do not have time to talk about all of them, and this is just a few, but some of the many, many ways that place and neighborhood affects our health. So we see here physical activity, traffic-related injuries and death, access and exposure to nature, social capital and connection, and many, many more have these profound impacts on our health and well-being. So physical activity, let's start with that. Incorporating physical activity into everyday life is one of the best ways that we can improve multiple aspects of health through design. Insufficient physical activity or sedentary behavior is one of the largest killers around the world today. Maybe you've heard of sitting being the new smoking. Countless studies have shown us, we know from all of this evidence over the years, that physical activity is actually one of the best ways to prevent chronic diseases and conditions, strengthen the immune system, and of course, improve our mental health and our cognitive learning abilities. It's really one of the most important things that we can do to reduce that chronic disease burden, the things that kill the majority of people around the world today that are completely preventable: heart disease, diabetes, cancer. And of course, we see places that actually do not support adequate physical activity in countless neighborhoods in major cities around the world, in the United States, but also in Australia, all across Latin America, for example. We have so many examples of neighborhoods and places that were designed for cars and not for people. And just look at this picture here. How difficult, polluted, and dangerous is it for us to get physical activity if you don't even have sidewalks? It's not even made for human beings. And speaking of, getting physical activity and exercise, how ridiculous. This is an old picture. I feel like it's from Florida or something. It's definitely the United States. It's 24-hour fitness. But how ridiculous that you would actually be meant to drive to the gym And then this is an even more exaggerated photo because once you drive to the gym, you actually take the escalator up instead of walking, which is so silly. But you could actually be walking, running, or cycling, or playing outside as part of your daily life. I, for example, never go to the gym. I have to get physical activity in my daily life. And of course, both of these examples that we see here are actually in the US. Somebody was from Atlanta. I'm also from Atlanta, so we know the Beltline. But we actually can get exercise as part of our daily life if we want to, and if we design our cities that way. Oh, okay, here we go. And then another example of how poor design can affect children's daily physical activity is walking to and from school. So there's many studies on this. A US CDC study found that distance and traffic danger were the main reasons that parents did not let their children walk to school. When new schools are built a long distance away from where families live, children are driven to school, which actually deprives them of obviously an opportunity for physical activity, but also for socializing with other students. And it contributes to air pollution and a risk for automobile crashes. But on the other hand, when we see safe routes to school are provided, and if schools are located within a biking or walking distance of where people live, then children can actually make walking or biking a part of their daily lives. And that really sets to establish healthy habits that can last a lifetime for children. So walking is one of those really easy ways to start and maintain a physically active lifestyle, and walkable communities or places or neighborhoods make it much easier for people of all ages to be active physically. And we can also think about creating what we call active transportation options in any project development, redevelopment that we're thinking about, like biking, putting biking or walking paths through our landscapes, and then really creating incentives for physical activity, which again, it improves all of these health outcomes. It also improves your mental health as well as your learning ability. And I have some statistics that really help us make the case. People who are in walkable cities get 30% more daily physical activity, which again reduces their risk of heart disease, obesity, diabetes, all those chronic diseases that are the leading killer of people today around the world. And in car-dependent cities, like many of us live in, we end up sitting for a long time commuting. It leads to higher obesity rates, all kinds of, risks for chronic diseases, but also a lot higher stress and anxiety. So we know that road rage is a real thing, makes a real impact on us. And then there's also the economic impact again. So physical inactivity costs the global economy $54 billion annually in healthcare and lost productivity. And then what about road safety? So here is a person on one side. It's a really awful photo, but it's not that uncommon actually in places like the US or even Latin America. So here's a typical person living and working in a, let's say, a suburban environment in the United States, crossing a busy highway to reach the bus stop. There's not even a safe crosswalk here. And millions of people like her die every single year across the world because of policies that prioritize that small minority, and it is a small minority of people who drive cars, over those that are too young, too old, or have a disability, or simply cannot afford to drive to reach their work or their school or their everyday necessities like grocery stores or the pharmacy. So not only is this completely inequitable, it's terrible for health. So again, when we think about redesigning places to make it easier and safer to walk or bike or take public transit, that helps to reduce the number of cars on the road. And the number, when you have a combination of the fewer cars on the road, and then how cars and bicycles and pedestrians share space, all those things are super important in reducing traffic-related deaths and injuries. So 1.35 million people, I want to say that again because I know that like sometimes the numbers don't have a big impact, but millions of people, 1.35 million people die in road accidents worldwide every year. And road traffic injuries are the leading cause of death for children and young adults aged 5 to 29 years globally. In the US, motor vehicle crashes, for example, car accidents are the leading cause of death in the US, in Australia, and across much of the world, but especially in the low and middle income countries. And of course, we know that when we design our roadways to slow down the speed of moving vehicles and buffer bicyclists and pedestrians from car traffic, it reduces the probability of death and injury from traffic crashes. So again, in the US, road accidents, driving, motor vehicle related injuries are the number one reason that people die ages 5 to 34. Young people age 5 to 34 should not be dying. Those deaths are 100% preventable. Plus, road traffic accidents, they actually cost the economy, the global economy, about $1.8 trillion annually in medical expenses, lost productivity, and infrastructure damage. So it's a really big impact. And you may know, I'm sure you've been to, you may have heard about Amsterdam being the most bicycle friendly place. So I just love this example. I know you had Leora on here last week, who's in Amsterdam. And some of you, whenever I go and talk to, especially in LMICs, but all around the world, some of you might be thinking that other cities are nothing like Amsterdam. You could never have biking as the number one mode share like Amsterdam does. But I just want to show you that, in fact, until the 1970s, Amsterdam also was extremely reliant on cars. In 1971, 3,300 people in Amsterdam, Amsterdam's a small city, 3,300 people in Amsterdam died prematurely because of car crashes, and 400 children were killed. And eventually, society actually reached a breaking point, and the city's car reliance was seen as intolerable with the high toll of child traffic deaths specifically. So they had a really, fierce activism, and they had a big campaign that was Stop de Kindermoord, or like Stop the Child Murder campaign. I hope I'm saying that right. I know there's a Dutchie on here. But that really is the spark that turned Amsterdam into the cycling haven that we have today. You can see a photo here of what some of that activism looked like. And when we look, again, we see what a big difference this is from 1971 to today, of course. And the reason I want to tell you the story is because I believe that any city, any citizen, any community group or activist group who is angry enough about children dying unnecessarily could also transform itself like Amsterdam if it prioritized health. Okay, so you get the idea. Designing for cars is bad for health and prioritizing health is better. But what are some of the other environmental epidemiological reasons to do that? So our good friends at IS Global have identified these 5 keys to creating healthier cities, and they include physical activity. We talked about that. Air pollution, we're going to talk about that. Noise, natural spaces or green spaces, and temperature. So mobility overall, right, can create a lot of negative health effects like excessive air pollution and heat and noise. But active mobility can also provide exposure to green and blue spaces and opportunities for physical activity. But globally, just to think about for a second, air pollution, actually globally, air pollution is still a leading killer. So it's responsible for more than 4 million premature deaths a year from outdoor pollution and also 4 million from indoor pollution. And this is pretty significant. 91% of the world's population breathe air that exceeds what WHO considers a safe level of air quality. Plus, air pollution also has a significant negative impact on development, including brain development, learning, and working memories at school, especially for kids. So in this recent IS Global study that I put some numbers on the screen here from, they found that cities in Europe, this was looking across just 100 cities in Europe, but those cities in Europe together collectively could avoid 166,000 deaths a year by reducing air pollution levels. And then similarly, there's a lot of emerging research on just how bad noise pollution is for things like sleep disruption, and in turn, again, children's cognitive development and stress and anxiety and related conditions like diabetes and obesity. So in that same IS Global study where they looked across 100 cities in Europe, they found that 60 million people are exposed to harmful levels of noise in European cities. Personally, coming from the United States, I think European cities a lot of them are way quieter than North America, Central America, South American cities, much of Asia and Africa. So if they could save that, if that many people are exposed in Europe, imagine how many are exposed in the rest of the world. Now, this is just a slide because we can't talk about all of it, but this is so important, right? There's a vast positive impact of nature exposure and green space. And I would say it's really just starting to be understood because we know a lot about how green space and nature exposure affects us in positive ways, but we're finding out more and more how profoundly important it is. And especially there are these huge impacts on mental health and learning. Okay. And I know you just had Jordi here talking about Barcelona, but just to show you again. So Natalie Mueller at the IS Global, again, from the IS Global team, found in one of her studies that overall 2,904 premature deaths, and that's actually 20% of the premature mortality in Barcelona is due to, I can directly tie it to unhealthy urban and transport planning. And that really comes from non-compliance with exposure recommendations for air pollution, noise, and access and exposure to green space and nature, along with excess heat from heat island. So maybe some of you who know Barcelona well know that Barcelona especially actually has a severe lack of green space compared to other major European cities, which is one of the reasons that the widely discussed, pedestrianization, greening, and reclaiming of public, social, and public space project, the Super EAs or the Super Blocks project, and also the sort of connected Green Corridors project in Barcelona has been so impactful. So you can see here one of the redesigned super blocks, and this is right next to my house. And I remember this when I lived here like 15 years ago. This was all cars. So completely different. Made a huge impact. And then here we can also see from one of IS Global Studies, they did a health impact assessment. And if all of the 503 super blocks were actually implemented, they are not right now. I think we have like 3. And the city kind of wants to stop them. But if they were all implemented, we could actually avoid 667 annual premature deaths a year in Barcelona alone. And then we also can see that there's preventable annual mental health burdens that could be avoided if the Green Corridors project, which is basically just greening different and pedestrianizing different streets in Barcelona, if that project was fully implemented in Barcelona. Because we actually know that mental health disorders account for over 30% of the global burden of disease, so not insignificant at all. And we know that green space exposure is associated with much better mental health. So here's another IS Global study where they looked across these 100 European cities, and we saw that 43,000 premature deaths could be avoided across Europe if cities added adequate green space and nature to urban environments. All right, I want to have adequate time for questions, so I'm just getting to my time, but I can't not mention isolation and loneliness. So I'm sure many of you have heard about it, but recently these have been declared public health epidemics, both in the United States and globally. And actually what we understand now is the severe health impacts of isolation and loneliness. And so one of the most effective ways to actually encourage social interaction and to decrease social isolation and loneliness is to create spaces that encourage and celebrate a vibrant social life for all residents, again, regardless of their SES or their gender or their age. And at this point, we have some really great evidence on how well-connected, compact communities with attractive and fun public spaces can support social life. And of course, as we know, adding ice cream and a water element never hurts. So there's all these ideas that we have, many of them coming from Holly White, who I mentioned at the beginning, coming from Fred Kent, Kathy Madden, Steve Davies, and the studying of public life. Of course, Jan Gale did similar work. And we really know a lot about how to facilitate social connection through design thanks to them. And we can look at the example of Bryant Park and so many others. And so, what I think the overall idea here is that this inequity that we see in our cities, the life expectancy differences, the health disparities, they are not inevitable. All we have to do is look at places, great cities in the world who once were also backwards and confused about how to support life and health. Look at Paris, look at Amsterdam, look at Barcelona, even New York City has done a ton, and countless others. And the question I want us to ask ourselves is, what kind of a place would we rather spend our time in? And we actually know what to do, and we actually know what benefits they will have. So again, I'm just gonna end here with my friend and mentor, Fred Kent, as he says, and actually the funny story is that I think this was the CEO at the time of Volkswagen. He said this and then he got fired after. But anyway, as Fred Kent says, if you plan cities for cars and traffic, you get cars and traffic. But if you plan cities for people and places, you get people and places. So in other words, cities are supposed to be places for us to live, for us to meet one another, for us to fall in love, to have fun, to socialize, and to live life to our fullest and healthiest potential. They are not places to be dominated by cars or highways where you scream at your children to not go outside so they don't get killed. And so if we want to live in places where our health and well-being can be fully supported and where we can contribute to our fullest potential, then I believe we should plan accordingly. I'm going to end there and leave time for questions, but of course we have lots of ideas about how to do that. Thank you so much for having me and for everyone for joining.
What would be your call to action so that health and city planning and quality of life, and to understand that it's not only infrastructure, but it's also the uses, the programs, the hardware, the software? What is your call to action to everyone that is here paying attention to your recommendations?
My call to action is just that every single time you have an opportunity to make an impact on the physical or social environment that you live in, that you consider what the health impacts are going to be. And that means if you're a citizen, if you are in local government, if you are an architect, urban planner, if you're an educator, anybody can have this important impact. And I just want you to think about for a second, what would the health impacts be of this project or of this decision or of this initiative? And is it going to be, helping health, or is it going to be hurting health? And who is it going to be helping and who is it going to be hurting? So I think if we just consider the health implications, we actually all can have such a huge impact. And I just want to say to the last point that you made, as you say, there's a lot more people to add. Space is not our problem. I love that idea that if everything was the same density as Paris with low-rise, mid-rise buildings, everybody in the entire planet could fit into the state of Texas. We do not have a space problem. We actually don't have an overcrowded density problem. We have tons of space. We just have to design it correctly and properly. And I would say, to your point, we have to have all of the ice cream shops and the yoga shops and everything in the same neighborhood. I also think that means it needs to be mixed income, which is kind of still a radical idea. Not that many places are doing mixed income, but if you want to have the coffee shop and all your amenities in your neighborhood, everybody has to be able to live there.
I totally agree. I love that. Also, many of the questions are about equity. And I love that idea because people talk about the 15-minute city and say, oh, it is so cute. I want to have everything within walking distance. I want to have the coffee shop. But also the 15-minute cities that the people making your coffee also lives in the same neighborhood. It's for everybody to be within 15-minute walking distance. It's not just the people purchasing the coffee, but the people preparing the coffee. Giselle,
Exactly.
thank you very, very much. What a wonderful presentation. Everybody will have this in gpenalosa.ca within 2 days. Please share Giselle's presentation to the elected officials, to city staff, to advocates, to media. And remember, 2 weeks from today, we are going to have the mayor of North Vancouver, a small city that was chosen among all Canadian cities as the most livable city. Giselle, thank you very much. And everyone who connected, thank you, thank you, thank you.
Thank
See
you
you
so
soon.
much. Thank you to everyone. Thank you, Gil.
Wow, Giselle, thank you. Thank you very much. What an amazing presentation. You provided so many examples from parks, from sidewalks, from streets, from young people, from older people, on how we need to create cities where the easy option is to be healthier lifestyles, how to walk, how to ride bicycles safe and joyfully, but the importance of having trees and green areas within short walking distance, especially in the low-income neighborhoods and everywhere. So I hope that people that watch this video will share it with as many elected officials as possible, with the mayors, with the city councilors at the state or provincial level, also with the media and with advocates. And I hope you keep joining us every other Tuesday on Cities for Everyone, the webinar.